Gillies. After receiving her call to ministry in 1982, Dr. Ann Gillies became an ordained pastor and a licensed marriage and family therapist. She studied both theology and psychology and received her Ph.D. in the philosophy of professional counseling from Liberty University. She spent 25 years in private practice, working extensively with childhood trauma survivors, and then founded Restoring the Mosaic, a ministry that seeks to educate and inform politicians, community leaders, and pastors on how they can help restore the mosaic of our God-given identity. Her mission is to provide accurate and truthful information in the areas of trauma, attachment, child-adolescent development, gender confusion, and sexuality. She speaks widely on these subjects at conferences and seminars and has written several books, including Deep Impact, Closing the Floodgates, Damaged by the Predators Among Us, Implosion, When the Pendulum Swings Too Far, Whatever Happened to Emily, and Ultimate Deception, The Dangers of Gender-Affirming Care. Anne and her husband Bob live in Dundalk, Ontario, Canada. They have a blended family of 6 adult children and 12 grandchildren. Please welcome Dr. Ann Gillies.
Hello, everyone. Well, it is such a privilege for me to be here. I'm just going to move. There you go. I'm going to move that computer back. And this is so interesting. One of the girls backstage just said, "Your Bible matches your coat." Well, I didn't plan that, but I bought it yesterday. I cannot avoid bookstores. So I was reading this morning, and I just opened to the book of Joel. This is what I was reading. "Hear this, you elders. Listen, all you inhabitants of the land. Has anything like this ever happened in your days? Tell your children about it, and let your children tell their children, and their children the next generation." Now, Joel's talking about a little different scenario, but I want to suggest what I'm going to talk about today is something that you need to tell your children about, and that they would tell their children as well. We need to tell the truth. It is loving and kind to tell the truth, especially in a generation and a culture like we're living in. And it says this, "Wail, you ministers of the altar, come and spend the night in sackcloth, you ministers of my God. Announce a sacred fast," and I'm jumping ahead, "and cry out to the Lord." We are in desperate times, folks. And, you know, I'm from a very progressive country, Canada. I have been impacted by the LGBTQ community for about 45 years, and our family story is what I wrote in Damaged by the Predators Among Us. And that story is about the, I don't like to say this, but the infiltration of pedophilia within our churches, as well as within our culture. We have an academic culture that is bound and bent on making pedophilia acceptable to the masses and indoctrinating your grandchildren in our educational facilities, public schools. So my mission is to expose the darkness, and we heard it yesterday, the days when evil is called good. We are living in those days. My passion is to protect the lambs And we need to protect them from the claws of this insidious agenda that's aimed at the annihilation of humanity. That's what we're facing, the long story. Anyways, so I'm going to be talking about ultimate deception and the dangers of gender-affirming care. And that's my latest book, so you're going to get a really quick overview and a lot of information I'm going to dump on you. Take a deep breath. Do I hear those deep breaths? So I know this is going to be kind of a drinking from the fire hose, but let's get started. You know, when your doctor tells your child or tells you as a parent or even grandparent, do you want a live son or a dead daughter? That's what our medical and psychological professions are telling children and parents on their first visit when a child claims that they are born in the wrong body. Now, we've heard of the born that way for the last 50 years, and lots of our culture, our whole culture has adopted that. We know it's not true. And now, transitioning children are using the same thing. I was born in a boy's body, or I have a boy's brain, or I have a girl's brain. And so this is what the doctors are threatening with for our parents and grandparents. They're intimidating them, and it's not true. They're not giving truth. Let me go back and talk about the prevalence of gender dysphoria. Fewer than 1 in 10,000 adult males and 1 in 30,000 adult females experienced gender dysphoria. And what is dysphoria? It's a distress. It's a distress over their sex. Everything's confused in the language, so it's a distress over their biological sex. It doesn't seem to match what they feel in their hearts. Not truth, but what they feel. So now, natal girls comprise between 50 and 90% of clinical adolescent samples with gender dysphoria. Everything's been flipped upside down. There's no objective truth, no laboratory imaging, or anything to diagnose a true transgender child. You can't diagnose it. But by adulthood, between 61 and 98% of these children will outgrow gender dysphoria. In fact, usually by the time they hit puberty or just shortly after, their minds start to catch up and they realize that they aren't transgender. That's without medication. That's without social transitioning, which we are all into now. So there's no way that doctors can know that a child will either desist or continue on that trajectory. Here's the referral rates. This is taken, it actually is just up to 2018, but I have some other reference at the bottom. The referral rates of girls and boys in Tavistock Clinic of gender dysphoric children. Look at 2009 and the percentage. I think it's about 152. Anyways, and then it goes up exponentially from 2013 onward. And so this is a social contagion. It's a contagion. It's just literally enveloping our children because they're being taught in our public education that this is something now they can do, and they're being encouraged. In 2021, there were more than 5,000 referrals. So Tavistock, I'll talk a little bit later what's happening, but it's closed. Their gender clinic has closed in 2023. So we have some good news that's happening along with all the negative. But here in the US and Canada, we are set on a trajectory of putting these kids, so to speak, on a conveyor belt to mutilization and to early death. In 2014, the cross-sex prevalence in the US was 0.6%. or 1.4 million people. That's not what you hear in the media now. You would think that half of the population is trans. Well, it's starting to creep up because of this contagion. 2020 to 2021, the number of children aged 6 to 17 diagnosed with gender dysphoria increased in the US by 70% in 1 year. In 1 year. Let that sink in. 70%. Where are the medical associations? Where are the doctors that will say, something is very wrong here? We don't have increases of 70% in the medical field and not do something about it. 2021, as many as 1 in every 100 now identify as transgender. These children are intentionally being confused about their sexuality. I have to keep going fast because I want to be able to get through all these slides. So I will keep running through these. Like children with other forms of psychological distress, these children present in a context of multiple interacting risk factors. And those risks include insecure or disorganized attachment to parents or particularly to caregivers. There's some unresolved trauma, perhaps, on the child. Something's happened to them. Often sexual abuse has happened. But also, what I want to say to you right now, sexual abuse is it's happening in the schools because it is sexually abusive to show children pornography. And some of the books and the library books in our schools, in our public school systems, if it wasn't in diagrams, it would be like a Playboy magazine. I'm telling you, teachers, not all teachers, there are some good teachers, but it is part of this radical sexualizing of our children to expose them to sexual experiences, and that's child abuse. We have a loss of family cohesion, and they often have multiple child effects that have happened to them. So this is the children that are presenting as gender dysphoric. Pre-existing mental health concerns, usually, about at least 3 pre-existing mental health concerns. So these children are the most vulnerable, and they have histories. The latest research I read, and is very new research, is that 48% of the children presenting now as transgender are on the autism spectrum. They are targeting our most vulnerable children, and they are winning because your child in the public education system spends 6 hours a day listening over and over and over again to teachers, if not in one class, in another class, who are progressive in their mindset and in the LGBTQ agenda, because the curriculum is full of, I would say, LGBTQ promotion. Now, all of these things predispose a child. And so what they're getting at school is a lot of information, false information, and it's very hard for the parents to counteract that. Even if the parents take their children to church every Sunday, you have to have information and truth that counteracts what they're being told in schools. And in Canada, many of the Christian schools have capitulated and introduced gender ideology in their schools because they're fearful. Churches and pastors have been so fearful. Very few want to actually address this, and very few will speak about this issue because the culture has so embraced it. And pastors, bless them, they don't want to lose people from their congregation. But I'm telling you, shepherds, you read Ezekiel 34. We need to understand this is the flock that shepherds are to speak truth into. And God will judge the shepherds. The shepherds need to protect their sheep, and especially the most vulnerable, the children. So there's a 2 to 3-fold increased risk of psychiatric disorders, depression, anxiety, suicidal ideation, suicide attempt, and self-harm for these children as they're transitioning. Believe me, putting them on puberty blockers, even though the mainstream media will tell you this is good because they take very biased scientific research and say, yes, this is good, it's not. It's not helping. Let me keep going. Suicidality was consistently higher for females. Now, I'm talking about suicidal ideation, not actual suicide attempts or suicide that is completed. And I want to say right off the bat that no matter how few suicides, it is a horrific thing to have happen. But in Tavistock Clinic, I showed you the trajectory. The number of suicides was 0.3%. It's not 40%, what they're telling you. And that's why the doctor who says, do you want a live son or a dead daughter, is lying to you, is lying. These children have a lot of behavioral and emotional problems to start with. But let me talk about this. In Australia, 2021, here's what they determined. They come from families with a lot of conflict. There's a lot of parental mental illness. And going back many years, this is till 1990, in the 1990s, I want to say 1993, but it's around that time, a study was done on, and they were called transsexual, not transgender. Transgender, by the way, is not a medical term. It's a political term. It's something, it's a made-up term. But really, these individuals were transsexual. And those individuals, when they were children, there were some studies done on gender dysphoria, the gender identity disorder it was called then, because it was actually treatable, not like now in our culture because of conversion therapy and affirmation only treatment, which means you have to agree with your grandchild, and the teachers must agree and check mark it. But in the 90s, the study showed that 53% of these boys, it was boys predominantly then, had mothers who had borderline personality disorder. So this is not about judgment. This is about reality, that often there was severe mental illness within the family unit, and that predisposed. And often the mothers, and I'll get in, I'm not supposed to get into all this really, it's not on my slide, but the reality is right from the womb, a mother can reject her baby. And often they find out early what the sex of the baby is. And a lot of these mothers didn't want a boy. And so they started, there's rejection way back into the womb. Rejection of the sex of the birth. And we have this whole thing that, this mindset, of course, we were born this way. Well, of course they may think that. It's not true. We know how God's identity is implanted, but things happen, can happen, trauma in the womb, all kinds of things. And so here were these mothers that were treating their little boys like girls, dressing them. And 53% of these mothers were borderline personality disorder. And if you don't know that, that disorder, it is the most difficult, in my estimation, other than schizophrenia, to treat. Anyways, so mental illness, separation of important figures in the home. You know, we're in a culture of divorce, bullying, and how many of you have been bullied in school? When you were in public school, did you ever get bullied? Yeah, me too. Anyways, and a history of maltreatment and adverse childhood effects. So the same kind of things that we've seen in Canada and the reports. But the American Journal of Psychiatry recently announced that there is no evidence that hormones or surgery help gender incongruent patients. You won't hear that on mainstream media. They don't publish this stuff. It's kind of hidden because it doesn't serve the purpose of medicalizing children for life, and it doesn't serve the purpose of big pharma, quite honestly. There are billions of dollars being earned, well, not well earned, in our hospitals by our doctors by transitioning your grandchildren. It is about annihilation. Affirming parents, by the way, do not affirm and do not improve the stats, no matter what you're hearing in mainstream media. Affirming a child in what they think, what they feel, doesn't improve the stats because it runs the risk of ignoring the pre-existing health problems and mental health problems that the children could be experiencing. You know, we love our kids. I don't know any parent that doesn't love their child. But loving does not mean agreeing. If we agreed with everything our child or our children told us, we wouldn't be parenting. We would just kind of be going, oh, it's okay, Joey, you just do whatever you like. It's okay, go run in the traffic. I mean, we need to sit back and think, what does it mean to affirm a child's delusion? Delusion. They are deluded, being deluded into believing they can be the opposite sex. Or deluded in the sense that they can have a healthy life by identifying as pansexual or queer or even homosexual or lesbian. The reality is, for homosexual men, their lifespan is reduced by 20 years because of the behavior. So do we want to affirm it? As Christian parents and grandparents, we must stand for truth. One of the things that I often say is that, you know, we hear about, parents are just so caught up. What do you do? What do you say? And it's easier to go along, especially a teenager, right, who's telling you they are in the wrong body and they know what they're doing, and a school affirms them and they're socially transitioning, and you better affirm them or else, you know, the parents will tell you, you can't speak to our child unless you affirm. You know, how many grandparents have heard that? You can't speak unless you affirm what our child is telling you. And I'm telling you, that is so sad. It's blackmail. Because what happens when that child is 25, and say it's a girl, because most often now it's 85% of those transitioning are girls, between the ages of about 13 and 20. And what happens when they're 25? They've been on puberty blockers. Then they went to cross-sex hormones. And in Canada, as young as 13, they're having double mastectomies. And at 25, they come back and say to you, Grandma and Grandpa, why didn't you tell me the truth? And that's what's happening right now, because there is a group of these children now, adults, young adults, who are detransitioning, and they're angry because the doctors didn't tell them the truth, their parents didn't choose to stand up for truth. I liked what Reverend Rodriguez said this morning. Are you leaning left? When he's talking about, no, we're standing. We have to stand no matter what. And that means you risk losing conversation for a period of time. And I know not everyone will agree with me, and I get that. Some people will want to keep the conversation no matter what, and so we'll go along with the child's, delusion. But this isn't like pretending they want to be a fireman. And this is not even like the goth, all the goth stuff in years ago. No. This is about annihilating humanity. This is so serious. Anyways, I want to keep going on here. So puberty suppression. So this is about a surgically implanted suppressant. And that's what's happening to a lot of our children. They get a surgical implant. It was originally developed for precocious puberty, which is also very rare, but sometimes some children move into puberty at like 7 and 8 years old. And there is this was actually developed to suppress that until, a couple years at least. But it was never meant for what it is now. It costs about $45,000 a year. And in Canada, we pay for it. The taxpayer pays for it. Puberty suppression, there's psychiatric symptoms that actually increase. And so a lot of irritability. And it's just this chaotic emotional roller coaster. If it was a roller coaster before they were socially transitioning and put on drugs, it's even more intense. It's horrific in these families. The parents are going through terrible things. Anyways, I'm going to keep going. I told you about desistance being common. Up to 98% of these kids desist by the time they're in their teen years. And it's 85% is about the average. So I can keep going with that. It is one of the most incredible scandals in medical history that's happening across the world, not just in the US and Canada. After a year on puberty blockers, children reported greater self-harm. So if they were cutting, if they were having struggles before, it goes up, not down. Now the science that the mainstream media shows us is saying, no, this is good, they're much better. It reduces depression. It doesn't. Actually, they have to go on antidepressants and a lot of other mental health medications, as well as the puberty blockers. There's more self-harm, more behavioral problems, and it actually exacerbates the gender dysphoria. Everything is opposite. Remember when we were talking about, evil is good? This is about the queering of truth. Right? Queering is turning everything upside down. So you have to be very careful what you listen to. There's a lot of physical things that happen to these children. Their bodies are compromised. I'm not going to stay on this slide very long. But there's also something, if you don't go through puberty, that's when your brain really starts maturing, recalibrates. You eliminate puberty. What's happening to these children? It's lowering their cognition. Cross-sex hormone therapy, you can never change your sex, and the amount of testosterone these girls particularly are being put on, It's never been witnessed, except if they're dealing with androgen-secreting tumors. So we have to think about, what are we doing? Complications, all kinds of physical complications from testosterone. And this is all in my book, The Ultimate Deception. Lots of complication. Women on testosterone. So women becoming men, almost 4 times as many heart attacks. For men, estrogen increases deep vein clots, blood clots, and strokes from 3 to 5 times. After 8 years, blood clots are increased by 16%. We're killing our children. Killing our children by allowing them to transition. But the parents are being intimidated into doing this. Breast cancer is 46 times higher than non-transitioning males. So, and it can include weight gain. Normal sexual functioning in the male is pretty much gone. And for the female, testosterone then produces early menopausal symptoms. These children become infertile for life. So, let me read this quickly. I have 5 minutes left. So, any potential benefits of gender-affirming hormones for these children must be weighed against the largely unknown long-term safety profiles of these treatments in children and adolescents with gender dysphoria. This statement came out of a review called the Cass Review that shut down Tavistock Clinic in the UK. We are seeing European countries pull back on the whole gender affirmation. This is a good thing. The reality is, a child will be a patient for life, and if they start puberty blockers, then they go on to the hormones, and then, of course, mutilation. I've talked about the 85% dissidence. But, so not only has the UK pulled back on gender affirmation for minors, but Finland, just in 2022, I think it was, rejects routine affirmation. What you're being forced into in the US and Canada, you must affirm, you must affirm. Finland is saying no. No routine affirmation for minors with gender dysphoria. Australia just published this. Our results suggest the need to address biopsychosocial, I wanted to say sexual, trauma-informed model of mental health care, which is what we should be doing in the first place, and what happened for 40 years before gender affirmation took over. We treated the children. We treated them with trauma therapy. We treated them. We treated their families to see what's going on within the family. We used psychoanalysis, and we worked with these children. That's why we had such desistant rates, because they didn't need to transition. So now these countries are going back to what we should have been practicing. France, in 2022, said there's no genetic predisposition, which is opposite to what you will read in mainstream media, and great medical caution must be taken in vulnerability and the many undesirable effects of medical interventions. We have to be careful. Florida is a bright light in the US. They're saying, yes, social gender transition should not be a treatment option. You need to listen to these truths, grandparents, because your children and grandchildren want to put you down a hole like this. You must agree with what I'm telling you. But if you agree, you are actually going to damage that child. Anyone under 18 should not be prescribed puberty blockers or hormone therapy, and gender reassignment surgery should not be a treatment option for children or adolescents. Just this year, just in the summer, Denmark joined the European Gender Affirming Care Backpedalers Yay. So Europe is kind of going like, woo, we're done with this. There's something wrong. We're seeing the results. We're seeing the true science. And we're telling parents, the medical practitioners, psychiatrists, psychologists, do not affirm a child under 18 years old. You know, adults get to choose what they want to do and how they want to be. And, you know, we get to pray for them. We might not always agree with their decisions. But for children, we must understand. We must understand and speak the truth to them. And we must listen to the real science, because this is what happens, that they get to this point where they are recognizing what they've done to their bodies, so many of them. And there's going to be more and more, and there's lawsuits. Tavistock actually has over 1,000 lawsuits against it from children who are now adults, who they transitioned, who they medically and surgically transitioned. That's just the tip of the iceberg. My prayer is that across the US and Canada, that these adults now will rise up and bring lawsuits against the medical associations, the doctors that are doing these horrific things. This is a warning to doctors. Speak the truth. Do no harm. Whatever happened, you're harming our children. Our psychiatrists and psychologists, I'm not really well liked in Canada by the associations, because they are pushing our children into this still. They are not speaking the truth. But we must stand firm and speak the truth. We can do no less for our children, for our grandchildren. Be strong and courageous. Be strong and courageous. Love them lots. Speak the truth in love, even if they don't want to receive it initially. And it doesn't mean you're going to be talking about it all the time, but you must tell them the truth, because the results of believing this ideology is crippling a generation. It's like the locust has invaded the land and threatens to take the minds and hearts of our children and our most vulnerable. Thank you for inviting me here. I so appreciate Legacy Coalition. It's been wonderful being with you. God bless you.